In health news tonight, March is National Colon Cancer Awareness Month. Every year there are about 150,000 new cases.
And it will kill nearly a third of those people who are diagnosed, but it is a cancer that's easily prevented. News 8's medical reporter Jocelyn Maminta live tonight in our New Haven newsroom with what a community health center is now doing to help save lives. Jocelyn?
Ann and Darren, the Fairhaven Community Health Center is just one of 3 in the country involved in developing a national model for screening colon cancer among its underserved and uninsured population.
Nationally, screening for colon cancer is around 65%, but it is even lower among the uninsured and underserved. At issue, financial and cultural barriers.
Not being to really understand the importance and why it saves lives, dealing with what in some cultures is perceived to be embarrassing, talking about, their colon and their bodily functions.
Dr. Suzanne Lagarde, CEO of Fairhaven Community Health Center, is getting more of its patient population screened for colon cancer, funded by a national grant. Key to signing them up, a network of specialists willing to see their patients and patient navigation.
Because of this navigation, the patients come, they're well prepped, and that's really what they want. I mean, they don't want to have a patient who doesn't either keep an appointment or it comes and then is not prepped.
Prepping them.
Anybody in your family has colon cancer.
Patient navigator Marilyn Vega.
I also call them the day before to make sure you're ready for the prep. You're going to start it at 4 o'clock. You're doing your liquid diet. All right.
Every detail is followed through.
There's some females that by culture has to be a female doctor, so I have to make sure that who's going to do the procedure is a female doctor.
Fear.
I was afraid that they were going to find something.
Is what kept Jeanette Collins from getting a colonoscopy at the recommended age of 50.
Well, I have a couple of relatives that did have this exam done, and a couple have polyps, and I have like a family history of different kind of cancers. So I said, Jeanette, you're 53, it's time to get yourself together.
For Madeline Rodriguez.
Not because I was not informed or anything, it's that I just couldn't. Sometimes you just don't have the money for it.
Taking advantage of the program brought relief.
I'm glad I got it done. It's better to do it the time that you're due for it than to wait and then you might find something and it might be too late.
Both women are polyp-free and 10 years till the next colonoscopy.
Did it meet your expectations?
A grant from the American Cancer Society through Walgreens is making it possible for patients at Fairhaven Community Health Center to be screened for colon cancer. The center treats more than 15,000 patients a year. Darren?